So you're about to have surgery and you want to know what to expect on the day of your surgery. Well, I'm here to tell you. I'm a recovery room nurse and I'll kind of take you through the process. So first you're going to start off going to the pre-op area. This is an area you go to before you're going into the OR to have your surgery. This is an area where the anesthesiologist will ask you about your medications that you take, your history, just to make sure everything is safe to put you under anesthesia. This is also where you will still be allowed to be with loved ones. Put away your belongings, pack those up, get dressed. There'll be a nurse there, a pre-op nurse that will put in your IV. Then you're going to go off into surgery. You won't remember a thing. That's the easiest part. You're going to wake up in recovery room, which is where I am. So before you come out of the OR, the doctor usually comes out of the OR, your surgeon, and they will come and talk to the nurses in the PACU saying, hey, this patient is about to come out. Here's the prescription, here the details, anything that we would need to know. When you wake up, you're going to feel maybe a little groggy. You might have some pain. The recovery room nurse should be right there by you. We are there to really help your pain, to monitor your incision site or the site where the surgery is, and to make you comfortable. So do not be scared to ask for pain medicine if you're still having pain. You do not want to be in pain after having surgery. There's nothing helpful about that, and don't be scared about taking narcotics because during this short amount of time you really need to consider how you're going to feel. You're not going to get addicted to these narcotics in the recovery room by taking these amounts. You're going to be completely monitored, which means you're little stickers that we are going to just be monitoring your heart rate, your breathing, making sure you're breathing okay, and you will probably have some oxygen on. Now we like to leave the oxygen on for at least 30 minutes. During that 30 minutes, patients usually are starting to trickle into waking up, but you only have to be in the recovery room for 1 hour if everything goes smoothly. There usually aren't any family members allowed unless maybe it is one family member at a time, but in my recovery room there's not any allowed unless it's like a decent environment, just because it's one big room where other patients are as well. The doctor will call your family member, so don't worry about it, because after the PACU, when you go into the discharge area, your family member is going to be allowed to be there, and that's where you get your belongings back. We usually don't want you getting up to go to the bathroom, so if you really feel like you have to urinate, we're going to get you a bedpan. Usually we don't want you standing up right after anesthesia because there's a high possibility that you might fall. You might be very hungry and thirsty because you just had something down your throat. You're going to have a tube down your throat to help you breathe, most likely, that we pull out right when you come to recovery room. And we put oxygen on you so it does dry out your mouth. You cannot have water yet. We're gonna swab your mouth and you won't be dehydrated regardless how it feels because you're gonna have IV fluids going. And then when you're getting discharged, we'll take that out. Once you start feeling better and more awake and more like you are able to be discharged, then we will start you off with some ice chips. Another common thing that happens in the recovery room, you might be feeling nauseous. Pain medicine really does make people nauseous. We have anti-nausea medications as well. Also, we'll probably sit you up straight, make you smell some alcohol, give you that medication. You have your IV fluids going to keep you hydrated and you'll be just fine. So be aware that that might be a possibility as well. You might have some funny things on your legs squeezing you and wondering what those are. Those are called SCDs, sequential compression device. They squeeze your legs because you're not able to move as much in surgery. So they're going to keep the blood flowing so you don't get any blood clots, and they squeeze your legs, bringing the blood back up to your heart, therefore continuing the circulation of your blood. Also, some people feel shivers when they wake up. That's totally normal. It happens a lot. We do have a medication to help for that. In every PACU there are warm blankets, so ask for one. They feel really nice. Just don't be afraid to ask for what you need and to rest. Don't be afraid to sleep, and don't be afraid to ask questions, and don't be afraid to ask for more. If you're really in pain and you just got pain medication, have the nurse be in communication with you. So basically, to sum it all up, you're going to come out from surgery to recovery room. You're going to feel sleepy. You might have some pain. We'll take care of the pain. We'll make sure that you're comfortable. Once you start waking up a little bit more from anesthesia and start feeling like you could take something to drink and stand up, you'll get discharged home. Getting your surgery most likely is the best thing for you to do. And this day should really be an easy, individualized process for you and what makes you most comfortable. So there's nothing really to be nervous about. If anything, it's just think of it as a nice nap and a good time to just relax. And good luck with your surgery. Thank you so much for watching. Bye.